Cook, for
Thank
being
you.
here today.
All right.
Next up is Dr. John Ropp with the South Carolina Medical Association. I hope I didn't mess that up. I may have.
No, sir, that was perfect.
Oh, thank you.
Chairman Martin, Chairman Verdon, and members of the Senate Medical Affairs Committee, good afternoon, and thank you for allowing me to testify today. My name is Dr. John Ropp, and I'm a family medicine, hospice, and palliative care physician in Hartsville. I've been a South Carolina licensed physician for 20 years. I currently serve as the president of the South Carolina Medical Association. I've reviewed the public testimony from last week's Senate Medical Affairs meeting, and my remarks today are made as a practicing physician and on behalf of the South Carolina Medical Association.
Sir, did you say not on behalf or on behalf?
On behalf.
You're on behalf. Okay, thank
sir.
you.
Yep. All physicians share in the grief and the frustration of the members of the public who testified last week. We send our condolences to those who have lost family members and whose lives have been forever changed because of this virus. In my own practice, even though I no longer see patients in a hospital, we care for many who have suffered greatly, and they look to me to help them make decisions about COVID prevention, treatment, and follow-up after some have become very ill and had to be admitted to the hospital. Our patients have real problems, and we want the best for them. Like us, they are looking for answers and hope that new treatments and new ways of dealing with COVID will help them and their families. 3 sentiments expressed in last week's testimony stood out to me, and I would like to address each one of them briefly. First, I agree that physicians should be allowed to practice in the way that they believe is in their patients' best interest. What sets physicians apart from other providers, systems of health care, and oversight bodies is our knowledge, training, experience, and understanding of disease processes, therapies, and most importantly, patients themselves. No institution, including government boards, departments, regulatory bodies, associations, or others, should unnecessarily interfere with core tenets of the physician-patient relationship. Of course, there are necessary limits on this relationship that will be respected, such as the law, evidence-based guidelines, peer review, and lawsuits. However, no matter who employs a physician, the physician-patient relationship must allow for freedom of practice. A second issue raised last week concerned federal and state interference with specific treatments for COVID. This has not been an issue in my private practice, nor has the SCMA been contacted by any physician members that have either had their practice or license threatened for offering or prescribing any particular treatment for COVID. The prescribing of FDA-approved medications being used off-label is not new, and as evidence is gathered, changes in prescribing do and should occur as with any treatment for a given disease process. Guidance from oversight and regulatory bodies is helpful, but as evidence and provider experience grows, no guidelines ultimately dictate whether a physician does or does not prescribe a treatment. The actions of the physician, again, is determined by proper judgment exercised within an informed patient-physician relationship. Recently, DHEC issued guidance regarding the use of hydroxychloroquine and ivermectin for preventing or treating COVID-19, but nothing in their guidance prevents providers from prescribing either one of these. Whether certain hospital systems have protocols preventing their doctors or pharmacies from prescribing these or other drugs for treatment of COVID, I do not know. But as an independent physician, no limits have been placed on me and my practice and my ability to prescribe what I consider best for my patients. The third important issue raised last week is the notion that patients have the right to demand certain treatments. Thankfully, I have never had this type of interaction with my patients. Physicians, however, are ultimately responsible for the prescribed treatment, and if we do not follow the standard of care, we should expect harm to occur and adverse actions as a result. The physician-patient relationship is one of mutual respect, care, and concern. Physicians listen to patients, understand their fears, their own concerns and wishes, and then decide with them the best course of treatment. There is no demand on either side. I appreciate the committee's time today and for allowing me to speak on such an important topic. One other thing I have noticed mentioned here throughout the day so far has been that of independent practice and decision-making. The Medical Association would welcome further conversation concerning that and how we can help any legislative body grapple with that because it's a huge issue, whether you're talking about CON, whether you're talking about different payment methods and contracting, sites of service reductions, or non-competes. So with those, I'll take any questions.
Thank you. Does anybody have any questions?
Chairman.
Why in the world did you bring up CON?
Yeah, we'll strike that from the record. Senator from Orangeburg.
Doctor, how many members do y'all have?
In the Medical Association, about 5,000.
Okay. And to your knowledge, none of them have reported to you that they have had any restrictions placed on them as far as treating patients?
As of this time, no physician members have contacted the association with those concerns.
All right. Now, as to the fact that the difference between an independent practice and then working for a hospital system, sometimes there are protocols or guidelines placed on doctors within the hospital setting because that's just the rules of their employer, correct?
That would be in that case.
Yes. And there's nothing really wrong with that either. I mean, that's just the way that it's the doctors practice. Some doctors practice within a hospital setting and some practice independently. If you practice independently, you're your own boss. If you practice in the hospital setting, the hospital's your boss.
Certainly.
And if they have certain guidelines, they just do. And that there's nothing wrong with that. It's just different, right?
It's just different.
Okay, thank you.
Thank you. Senator Verdon.
In all seriousness, Dr. Ropp, thank you. And whether it's CON or whether it's COVID, I want to make sure I'm not misunderstood today. The highest place I want the medical profession is on that pedestal right up there with the priest and the minister. And taking care of our constituency who is seeking to maintain collaboration. The term of collaboration. I've got a colleague right here who told me that if we don't see the genesis of the Medical Association working more cooperatively, more communication taking place, he's going to do it himself. So everyone is experiencing and feeling the exact same pressure points, and it's long, it's tedious, it's laborious. There's so many different perspectives in this room, so many different fields of service, but I truly believe you're president of the Medical Association. I told Dr. Cook that her trust and confidence building for me in a few minutes was compelling. The doctors that are aggressively operating in outside the lines, so to speak, of the position papers and the guidances, saving patients, we all are looking to you. I don't think we would be here if homegrown, trusted South Carolina medical professionals were in our frame as opposed to listening to a nationally directed, top-down, paternalistic, heavy hand that sometimes has just not been dependable or consistent. That doctor-patient relationship, if nothing comes of the work today, just to hear you and others, everyone that's been involved so far, echo the commitment to that principle and that guidance brings encouragement to me. So thank you, Mr. Chairman.
Thank you. Thank you for being here, sir.
Yes, thank you.
Next up, Mr. Thornton Kirby from the Hospital Association.
Thank you, Mr. Chairman, members of the committee and subcommittee. Appreciate the opportunity to be here. Members of this subcommittee had asked us to bring a number of people from across the state. We did that. We brought people from medicine, nursing, pharmacy,